Hi everyone, good afternoon. Happy Monday. We're live on Facebook, also PHLV Radio on this Monday. It is Family in Focus, a radio show organized by the Asian Community Development Council, ACDC. The goal is to help educate, empower, and connect all the people, AAPI community throughout Nevada with useful topics and information. And today we're going to be focusing on open enrollment. A lot of you may be hearing more about this now because open enrollment for Nevada, when it comes to your Silver State Health Insurance Exchange, that is starting on November 1st. So we're just a few weeks away now, and I have a special guest who's joining me to talk about it today. Rosa Alejandre is the Navigator Program Manager with Silver State Health Insurance Exchange. She's here to talk more about it. We're actually going to hear from Roseanne Epilito as well. She's the Health Services Manager of Family Services of ACDC. We're going to talk with Roseanne coming up in just a little bit, but we want to get right onto this conversation. A lot of people are thinking about this right now because of course, as you know, COVID-19 pandemic still going on. A lot of people have lost their jobs as well due to this pandemic. So they're probably going to want more information when it comes to healthcare and health insurance. So Rosa, I'm going to start with you. Introduce yourself and give us some information about what you do and what kind of questions you're getting right now from the community.
Well, good afternoon, Petrania. My name is Rosa Alejandre, and I am the Navigator Program Manager with Nevada HealthLink. We're also known as the Exchange. We're a state-based agency, and we run the Affordable Care Act program for the state of Nevada. So basically what we're getting right now is, when is open enrollment? Open enrollment is November 1st through January 15th this year. It has been extended. Usually it runs till December 15th, but we were lucky this year and we got a special enrollment approved by our executive director, and it will now run from November 1st through January 15th, giving our Nevadans more time to enroll and make sure we get over that holiday. Sometimes throughout the holidays, we forget about everything else and we forget to enroll. So now you'll have some extra time to enroll until January 15th.
Right. And so talk to us a little bit about this. If people have never gone through Affordable Care Act before, this is the first time they're doing something like this. What do they need to know? What's kind of the thing they have to kind of look through in order to, before they even begin this process of application?
So basically we are and you have to be a resident in the state of Nevada. Those are the main qualifications. Other than that, we'll ask you some information if you're working, if they offer health insurance, or if they don't offer health insurance. Once we screen you and we verify that you do qualify to be on this program, one of the best things about Nevada HealthLink is that over 80% of our enrollees actually qualify for financial assistance through tax credits and or subsidies. So it makes the premium very affordable. 4 out of 5 of our enrollees get financial subsidies. So I know we have some $0 plans and somewhere even $50, $100, $200 plans. It all is adjusted to your budget as well, because it all depends on your household size and household income.
Yeah. And then what are you seeing this year? Obviously, 2020 has been such a difficult year for so many people. And I'm sure that it comes with, losing their jobs, losing their employer-based sponsored healthcare, right? So are you hearing more of that? And I'm sure COVID-19 comes into play as well.
Yes. Well, one of the things about if you are losing your health coverage through your employer, I know COBRA is available, but sometimes COBRA may not be your best bet. With COBRA, you have to pay 100% of the fee yourself, plus an administrative fee. So if you were to compare to Nevada HealthLink, you do have 60 days from the day you lose your health coverage through your employer to look and shop and compare. I suggest please make sure you look at your COBRA rates and look at us, because I know we are an affordable option. And also with us, you can get tax credits and subsidies. So that's what we're hearing right now a lot about people that are losing their health coverage through employers. Now, all of our plans cover any COVID-related testing and treatment.
Yeah. And a lot of people do have questions about that. And I know ACDC, they do have their healthcare navigators, their family services department that really deal with this and work with you closely. Talk to me about the partnership that you have with nonprofits like ACDC and how important that is to kind of help and reach out to the community.
Well, we've have a great partnership with ACDC. ACDC is one of our one of 8 grantees that we have this year throughout the state. So, as part of the state of Nevada's program, we work with grantees like ACDC and many other nonprofits around the state, and we want to make sure that all Nevadans know that they have a resource in us. If we can't help you for whatever reason, because you may not qualify, we want to make sure we at least give you a resource as to where you can get some health care access, whether it's through a community center, it's through one of our local clinics here, another nonprofit. But ACDC has been a great partner. They obviously have several languages. All of their navigators most of them are bilingual. So that really helps for our consumers. And it's free, in person, unbiased information. We basically give them information that's available to them, and the consumer will decide what kind of plan is best for them. That's the best part about it. There's no pressure here with us. We just want you to know that it is available. Should you have any questions, we're here to help.
And I think might be a good time to bring Roseanne Epilito in. She is the Health Services Manager of Family Services at ACDC. And I know, Roseanne, you deal with the community who come into our office either through by appointment, or you even do Zoom appointments. So Roseanne, tell us a little bit about ACDC Health Navigator Program and the Family Services Program and how you offer when it comes to health insurance.
Thank you, Petrania. Hi, I'm Roseanne Epilito, a licensed health navigator and a health services manager from the Asian Community Development Council. So the Health Navigator program is partnered with Nevada Health Link, Rosa, with Rosa, our manager. Nevada Health Link is a state-based exchange, which ensuring that all uninsured Nevadans are taken care of. We are offering free health insurance enrollment assistance. And I am really excited to tell everyone that open enrollment is coming. It's from November 1st through January 15th. So for those who lost their coverage through employer, and for those who doesn't have health insurance, the Health Navigator program are here to help everyone. And we have 5 licensed health navigators. We can speak Tagalog, Spanish, Vietnamese, and Visayan. And we also have colleagues who can speak with different languages such as Thai, Japanese, Korean, and Mandarin.
Yeah. And so right now, tell us, because I know with COVID-19, you're only taking appointments only. I know your office is based in Chinatown here in Las Vegas. Have people been coming in, especially as we're getting close to November 1st and just with concerns about health insurance?
Yes. If you need a help with the health insurance, you can call us by appointment. You can call us at 702-782-4482. And we can do the enrollment via phone, FaceTime, Zoom, and even Google Meet. And for those who's not tech savvy and uncomfortable with those I've mentioned earlier, so you can meet us. You can set up an appointment and meet us at our office located at 4276 Spring Mountain Road, Unit 207. Zip code is 89102, is in Shanghai Plaza.
Yeah. And how big is the need out there? I'm sure with the different community. I know you speak Tagalog fluently, and are people reaching out who speak different languages and maybe they're still having kind of issues and concerns, especially trying to understand, it's such a maze of information when it comes to health insurance coverage.
Sa aking mga kababayan, ang open enrollment is malapit na sa November 1st at saka hanggang January 15. So kung sino man sa inyo nangangailangan ng health insurance, meron kaming mga navigators na nagsasalita, bilingual, nakakapagsalita ng Tagalog. Ayan, isa na ako doon, and meron pa si Joy at saka si Vice. So we can help you. Pwede namin kayong tulungan, especially sa mga naapektuhan ng COVID-19, yung mga nawalan ng health insurance. Nandito ang navigator ng ACDC para kayo ay tulungan. Tawag lang po kayo sa 702-782-4482 para sa appointment. Salamat po.
Yeah, a lot of people are getting help, obviously, in the Filipino community as well. Rosa, I'll bring you back in here. I know, with ACDC helping to be that community center and getting people, clients kind of familiar with this system. Talk to us about what you want people to know right now. I know we're just a few weeks away from, open enrollment beginning. What do they need to do and start gathering any kind of paperwork and things like that, a checklist for people?
Well, they can definitely visit our website at nevadahealthlink.com, and we have a checklist there. But some of the things that I can just rattle off right away is proof of ID for sure, proof of residency, proof of income. Those are the main ones that you want to make sure you have. The application will ask you for social security number and birth dates and all that good stuff. So it is a secure application. Please know that when you go visit any of our navigators, they are all licensed and certified through Nevada HealthLink. We know that they will be asking you for sensitive information, but that's why we want to post it on our website so that you're not taken aback when we ask you for this information, one, so that you're prepared. The second thing I want to make sure is that people realize is that we have now coming up for the next plan year 5 carriers, which is a really big thing for the exchange because we've had 3 for the last 3-4 years already. When we first started, we did have several. We obviously know that was a chaos time for Nevada HealthLink, but we have made such stride, and I am just so happy. I've been involved with the exchange since we started back in September of 2013, and the exchange has come a long way, and I can see that the carriers are finally seeing the stability in the marketplace, and I think that's why they're now participating. But we will have 5 carriers. We will have double the plans that we have right now. We have 6 dental carriers as well, and so they will have a choice of plans and also affordability, whichever one fits best their budget. So that is the most important things. Open enrollment November 1st through January 15th. Please don't forget it. And if you want coverage by January 1st, you must enroll from November 1st through December 31st in order to get January 1 coverage. If you enroll from January 1st through the 15th, you will have coverage February 1. And when we say enroll, we mean you have to go through the application and actually select a plan.
And is there kind of a waiting period, or can people, once they enroll, their health coverage kicks in right away?
Once they're enrolled, their health coverage kicks in right away. So as long as they met the deadlines of their enrollment from November 1st through December 31st, they can go ahead and use their coverage as of the 1st of January. I know most places, because it is a holiday, might be closed, but if you have an emergency and you will be covered. So that is not to be worried with. Also, if you enroll between January 1st, January 15th, your coverage will be February 1st.
All right. So if you're just joining us here on Facebook Live on the Asian Community Development Council Facebook page, also on PHLV Radio, we're talking with Rosa Alejandre today with the Silver State Health Insurance Exchange, and also with Roseanne Epilito. She's with the Asian Community Development Council. She's part of the Health Services Program, the Health Navigators, who are helping connect people with health insurance. And it's such an important information, especially if you have questions right now. Do put it on our comments, because I know right now with everything that's happening, this is really an opportunity, open enrollment, a time for people to take charge of their health, right? To really get that, all the information they need to arm themselves with in order to face whatever comes next year. Because once you have that health insurance, it's that protection in case something happens. And Rosa, and I wanted to stress that you can, change prescription or your health plans with special circumstances outside of the open enrollment period, right? I mean, there are special circumstances that people can look into.
Yes. So if you, for whatever reason, you pass general open enrollment and you didn't enroll, but later on down the year, let's say you got married and now you need health insurance. There are some conditions in all special enrollment periods, but that is one of the qualifying life events. Or you have a baby, you adopt a baby. That is also another qualifying life event. So with those type of events, we call them special enrollment periods, and a person has 60 days from the date of the event in order to get health insurance on the marketplace. And all of those are listed on our website too. We have dedicated a website just directly for special enrollment periods and qualifying life events. But you do have 60 days to enroll after that event has happened if you want to, if you do not get in during the open enrollment. Now, during open enrollment, you can still qualify for a special enrollment period. It doesn't mean that because open enrollment, none of that applies. No, because at any moment, if you have a baby and it's during open enrollment, they still give you the 60-day period for you specifically for that qualifying life event.
Okay, yeah, that's good to know. So people, of course, always when it comes to getting health insurance, they want to get a plan, especially if they've gotten a cheaper plan, being employed, and now they have to get for themselves. It's like, okay, I want to make sure that I can afford health insurance for the best plan that fits their needs and their family's needs. And you said that one of the benefits of joining your program is that there's an opportunity to get state subsidies, right, to help with their plans.
Exactly, yes. So all of our applications are unique. They're unique because every application is based on the household size and household income. So depending on that, your premium will be adjusted to just your application. To say over 80,000 people that we've had on the marketplace, not all 80,000 pay the same premium. So it is unique to your situation only. And so again, perhaps with your employer, it may be too expensive. Give us a call and we will see if according to federal guidelines, it is too expensive. And if it is, and you can come on to our marketplace, we'll be more than happy to tell you what plans you have. And yes, with our plans, you can also see what provider network and prescriptions are available on those plans before you actually sign up as well. One other thing I wanted to let you know, Petrania, is that we also have what's called a federal poverty guideline. It's a chart that we use and we have it on our website. So perhaps if a household of four, anywhere making from $36,156 all the way up to $104,000, that family of four could possibly get some subsidies. So it will just depend, again, on your income and household size and your application. We will go ahead and take all your information into account. And like I said, it doesn't have to be that you are only making $20,000 a year. We know that people, depending on their household size, our plans, you can go up to 400% federal poverty level and make up to $176,000 and still may qualify for a subsidy.
And I think this is why it's so important for people to do their research and call, just try to get as much information to see if they qualify. Because I think some people think, oh, I make too much money, or this is my family circumstance. I won't, this won't fit with me, or it's going to be too expensive. I think there's just enough variety out there to fit so many different kind of families' needs, right?
Yes, exactly. And that's why we went ahead and listed our guidelines on our website, and we will be having, I want to say by the end of the week, we will have our new resource guides, and they actually look like this. And these resource guides will be throughout the whole community in Southern and Northern Nevada and in our rural areas. And in this resource guide, you are going to see, in addition now, our federal poverty guideline checklist. So it will be in here. That way it'll be easier for you to just look at and then give us a call. You have any questions, you're more than welcome to do it online by yourself. But insurance is confusing and sometimes you do need some assistance. And that's why we do these programs with the grantees, to make sure that when our consumers aren't sure, or they just they don't know, let's just say they don't know, or they're not technically savvy, give one of our navigators a call, give one of our brokers a call. They will be more than happy to assist you and give you this information for free and make sure that you get into a correct plan for yourself.
Well, let's get one of our navigators now, who's actually here with us, Roseanne Epilito. She's with the ACDC's Family Services team, and you deal with all these kind of questions. And Roseanne, you speak Tagalog, so you help people in different languages, because as Rosa was saying, it's already confusing as it is in English. And if you have a language barrier, and that's why it's so important for ACDC to step in and help with that. And Rosa, I know that your organization also does a number of events, including one coming up this Sunday, where people can actually come up and talk to you, right? And get more information when it comes to health coverage.
That's exactly that's right. I'm sorry.
I'm sorry. I didn't know if Petrania asked me or asked you, Anne, but go ahead, Anne.
It's okay, Rosa. Okay. This coming Sunday, October 25, ACDC will have an event. It's a food distribution and drive-up flu clinic. So navigators will be there. We will have a table there. And for those people who have questions about open enrollment, special enrollment, health insurance, we will be there from 10 a.m. to 1 p.m. So we will give away also Nevada Health Link freebies. So just go there and have a free flu shots and also food.
Yeah, it's such a great event. And both Roseanne and I were actually at their event just yesterday, October 18th. They just had one at Chinatown Plaza. And this was a food distribution event. And I think we have some pictures from there too. So Roseanne was there and, other members of ACDC and the Philippine Nurses Association in Nevada. They were giving out free face shields, free masks. So a really great community event. And what's great is I was sitting at the ACDC table to help, volunteer and give people any kind of information they need. And I noticed that Nevada Health Link also they have brochures there, they have information. So people do have questions, they can come, and we have ACDC staff and volunteers on site at these community events so they can get more information about health insurance. And Roseanne, and you're in the Filipino community here in Las Vegas. Have you run into issues where people just confused, like, oh, I don't know what to do, I need health insurance, and it's just been so confusing for them?
Yes, especially right now during the COVID-19, the pandemic. So some of them, they lost medical benefits because they lost their job. So any questions about that? Health navigators of ACDC, can help you. You can just schedule by appointment again at 702. You can call us at 702-782-4482. And our office are located at Shanghai Plaza, and so you can call us and schedule an appointment to help you with everything about health insurance.
We're going to put the website, address, phone numbers, anything you need on the Facebook comments too, so people can always come back. And if you're watching this right now and you're just jumping in, we started at noon today. Actually, every Monday we start at noon. So if you want to jump in for our conversation next week, you can always go to our Facebook and share the page with whoever needs this information. So some great information. And Rosa, one of the things we're talking about, the deadline, open enrollment starts November 1st. And here in Nevada, it actually got extended to January 15th. So this gives people more time this year in order to enroll, correct?
That is correct, Petrania. We extended the open enrollment, so it will go from November 1st through January 15th. And we just want to make sure that it gives everybody enough time, and especially with everything going on right now, we know we have a lot of things on our mind, from COVID to obviously what's going on nationally with elections and stuff. So sometimes people forget, my health insurance, right? So I'm really glad that we were able to extend this open enrollment this year to January 15th.
What if people miss the deadline? Is there a way to still get in and get healthcare through Affordable Care Act?
So if they miss the deadline through open enrollment, the only other way would be through a special enrollment period. And again, you would need to have a qualifying life event in order for you to get in through a special enrollment period. A qualifying life event can be having a baby, perhaps you gained U.S. legal status, you got married, you moved here from another country and or state, So any of our qualifying life events, and again, all of those are listed on our website at nevadahealthlink.com.
All right. So I think we touched on a lot of issues and topics now. Anything else that I haven't asked you? And I know so many people are needing this. I think, millions of people in Nevada alone will need healthcare, and maybe they've lost healthcare lost their jobs or, other circumstances in life. What other information do you want to put out there, Rosa, that people really need to know right now as we're getting close to the start of open enrollment here on November 1st?
Well, first and foremost, please don't forget to do your health insurance, because again, I'm sure everybody's aware nationwide what's going on with the Affordable Care Act, and many people thinking that it may be taken away. We have it right now. Take advantage of it. There is a pandemic going on right now. Please don't wait till something has happened and then you're looking for health insurance, because it works like car insurance. You do not want to have an accident and then get car insurance, right? You need to have health insurance prior to you getting sick. We cover pre-existing conditions, so don't get me wrong, but you don't want to wait till you're in the hospital and then it's not going to cover that particular visit, and it could be $20,000, $30,000 visit, right? So you want to make sure you do get your health insurance taken care of. Again, we give you ample time, November 1st through January 15th, for the Affordable Care Act health insurance through our marketplace at Nevada Health Link. There are a lot of seniors out there right now, and they may get confused with us as well because of Medicare. Their open enrollment is October 15th. It just started October 15th through December 7th. They kind of confuse us sometimes with that as well. Another thing is Medicaid. Sometimes they confuse the Affordable Care Act with Medicaid, and it's because it is kind of intertwined, because with the Affordable Care Act, we did expand in the state of Nevada Medicaid. We can assist you through Nevada Health Link. We can assist you with your Medicaid application should you need assistance as well for that. But there's no per se open enrollment for Medicaid. Medicaid, you can enroll at any time. But if you give our navigators a call, they'll be able to help you to see whether you are ready for Medicaid and or one of our plans, and they can help you do the application as well. The best thing you can do is go to our website, nevadahealthlink.com, or give ACDC a call. All of their navigators are friendly. They've had time with us. They're one of our best grantees with us. We've got such a great partnership, and especially because of the language services that they provide. We just want to make sure that our community knows we are here for you, and should you need any assistance, please give us a call or ACDC a call as well.
And I want to bring in Roseanne here for some final words. And Roseanne, feel free to do this in Tagalog as well. We covered a lot of information today, especially when it comes to open enrollment. What would you want to put out there for people listening and wanting to get some help, especially when it comes to in different languages that we offer at ACDC?
Okay, I will talk about in English first, and then after that, Tagalog. For more information about health insurance and about ACDC services, especially the Basic Needs Assistance Program. For that BNA program, we are providing cash, rental, and food assistance. For those who's affected with COVID-19, just visit our website at acdcnv.org and follow us with our social media, Facebook, YouTube, and even Instagram. So just visit our website again. For more information about our future events and our program and our services, just visit acdcnv.org. So I will speak in Tagalog now. Okay, sa lahat ng aking mga kababayan, ang ACDC po ay nag-o-offer ng program, especially the Basic Needs Assistance Program. For more information about that, pwede nyo pong bisitahin ang website po namin, which is acdcnv.org. And pwede nyo rin po kaming i-follow sa aming social media, Facebook, Instagram, and YouTube. Thank you.
All right. Well, thank you to you, Roseanne, and all the ACDC team who have been just amazing. And don't forget, they have their big event coming up. We want to put the banner up for people to know. Again, this is a big one coming up October 25th. Next Sunday, it's a food distribution and drive-up flu clinic. This is all free. Just yesterday, they fed over 300 families. We're expected to help more families coming up. So the next event, just put it on your calendar, 10 a.m. to 1 p.m., October 25th, Chinatown Plaza. So right in the middle, just drive in, get your free flu shots, get your food distribution, and also get information from ACDC and other groups when it comes to health coverage, especially with open enrollment. So I want to thank my guests again today, Rosa Alejandre. Thank you so much for joining us and for your time today. And also Roseanne Epilito with ACDC. If you're watching us right now, Family in Focus is on PHLV Radio every Monday from 12 to 12:30. We're going to give you some great information in different languages, as you can see today in Tagalog, and also Rosa for giving us great information. So definitely get out there, register to vote, and also get your health insurance taken care of before 2021. So thank you so much for joining us today, and we will see you next Monday. Have a great day.